this time, I would like to introduce Dr. Traymanesha Lamy. She's the founder and CEO of Javilyn Consulting, and she also comes with a lot of experience as a practitioner, a researcher, motivational speaker, a leadership coach. And so her bio is here, so I'll let you all read that and see all the wonderful things that she has done. But at this time, I'd just like to call her to the podium. And so she is going to speak to you today about power building. So welcome her as she comes.
Good morning, everyone. Good morning, everyone. Good morning. Yes, this work requires energy and action. I'm really excited to come and talk to you today about power and impact and thinking through community power building and the work that you do individually and the work that we can all do collectively. Okay? I want us to be, and this to be an engaging presentation, so please feel free to interrupt me if you have a question about something. And I'm going to be asking you all some things to kind of do a little bit of call and response as well. I want to can we give it up briefly for Dr. Green, who just went? I think that was a great presentation. And a lot of what she stated is actually you're going to see elements of that in this presentation here, okay? So, community power building for health justice. One of the questions I want us to think through together is how can we really engage in community power building, and how can we do this through three different steps. One, we want to identify what the challenges and issues are. We want to begin to ignite and implement strategic steps and things that are going to help to impact our communities in powerful ways so that we can transform the healthcare system. I approach this work through the lens of collective impact. How many of you are familiar with or heard of collective impact previously? Okay, one. Okay. So collective impact historically, the work was really talking about bringing together various organizations, right? Like how can organizations come together, establish a common agenda, think through how they can kind of share metrics and measurements, and really do meaningful work within communities. Let's say about 5 years or so ago, they inputted in that language the individual or the community member, which is essential to the work, right? So anytime you're thinking about collective impact or collective change, you have to first and foremost center the community in this work, right? So if we think about the 5 stages of collective impact, the first one, a common agenda, what is our purpose? What do we all seek to do? Not as individual organizations, our mission statement, but what is it that we all seek to do to change collectively together? What are some shared things that we can measure to show impact over time, right? This is not a one event and then it's done, but what does the work look like over time? What is our journey? I heard journey mentioned before in the word. What does our journey look like over time, and how do we measure impact over time? And so we want to make sure, too, that there are mutually reinforcing activities, so that it's not just we did this event, we had this event today, and then we don't meet and we don't come together again. We want to make sure that the activities and the things that we do, we build momentum over time so that we can impact change in our communities. And we also want to make sure there's continuous communication, that people are talking to one another throughout the process and throughout the work. If you're bringing together the community members, if you're bringing together various organizations and coalitions, how are you all communicating with them on a daily basis? And are you only coming to them when you need something? And then also the final part of it is the backbone support. There always needs to be an organization, an agency, an advocate that is willing to step in as a lead role in helping to fuel it. They are not the only doer in the room. The room should be full of people that want to actively engage in it and support whatever the mission is as far as the goal, the collective agenda is. But there should be a backbone support that's available and offered as well. So that's a little bit about what collective impact is. Community power building is similar to collective impact, but it takes a different stand. It's not only saying, yes, community members need to be at the table, but the people need to be centered in the work. They are not an afterthought. They are the decision makers. And we need to go beyond just hearing their voices, but we need to include them in the room when we're starting to talk about policy, when we're starting to talk about things that need to happen and actions that need to be taken, and when we're offering out funding, right? Sometimes what happens is that organizations receive the funding and the community doesn't, and the advocates don't, right? So community power building makes room and space for community to be in the building, in the room. But it's really also thinking about them as change agents, right? And that idea of them being change agents first rests on the premise that individual people have power. We have to dispel the myth that communities don't have power, communities of color don't have power, Black men don't have power, our youth don't have power, and our seniors don't have power. We need to dispel that myth. It's not someone that's going to come in and save the community. The community needs to be able to have space and room to invest in change themselves, and they need support. But they don't need, I heard earlier, and I'm going to mention it today, nothing for us without us, right? And that's part of the disability movement. That's one of the phrases that they say. You know, you can't do this work without first acknowledging that we need to be in the room. We need to occupy the space, and we need to occupy those seats, right? So I really want us to think through collective impact today as a strategy, but power building as the activation piece that needs to happen in order for collective impact to work, right? When community power building is done well and it's done successful, you notice a couple of things, and that's what I really want you all to think through too. It should be evident in the work, right? One, not only are clear agendas set, but there should be movement and energy seen within the space. There should be some type of shift in the public discourse. It's the difference between talking about people and having people share and tell their own stories, and having people advocate for themselves for change in the community. That doesn't mean that individuals are the only source of power and change within it. It means that coalitions, collectives, and organizations need to make sure we create space to engage them in a deeper, richer way, all right? So I mentioned before, nothing for us without us. I'm just gonna read this quick phrase. Community power building is particularly critical for underserved, underrepresented, and historically marginalized communities who have been excluded from decision-making on the policies and practices that impact their health and the health of their communities, right? So this is just an example of how power building was embedded in some work that took place out in California. And I wanted to share that with you all just as we think through like the possibilities of the various things that we can all do collectively together, right? So one example is from the Building Healthy Communities, which was funded by an endowment in California. And they really took organizing and base building and engaging community seriously and put that at the front and center core of their work. I always say this is like it always reminds me of a sunflower for some reason. Y'all see it? Is it just me? You can see it? Okay. I always say the sunflower diagram. My team is like, what? You know what I'm talking about. But this is the sunflower diagram if you ever want to. And then you have a one-pager here, too, from USC. And they provide a whole bunch of different strategies on power building and things that you can do to really thoughtfully engage community in meaningful ways and build on the strategies that you all are already utilizing within your various organizations and the work that you do on a day-to-day basis. And so a couple of things that stand out. One, advocacy and policy, thinking through how we are talking about the work, how we're advocating for change within our community. Communications and narrative change, how do we shift the dialogue about what people are saying about what the issues and the challenges are? Because oftentimes, the way it's framed in the media, people, especially people of color, are viewed as the issue and as a challenge, as opposed to as a part of the change that needs to happen within our communities, right? So being able to shift that dialogue, inviting additional coalitions and alliances to the table that are already out there, that already exist. How do we connect them to the work? And how do we make sure that there is funding for the work over time, right? Because of the work that they did out in California in this particular example, they were able to come up with over 1,200 policy and system change benefits to the community, right? The community was active in planning. They were active in executing it. So once again, it wasn't done without them. It was done with them. And then their ideas were also brought to the forefront of the table. In order to do this work, though, I always say one of the fundamental pieces is establishing authentic relationships. We talked earlier with Dr. Green, mentioned about mistrust. Oftentimes there's mistrust in the community because historically people have been underserved, people have been looked at or viewed as the afterthought, as opposed to centered in the work, right? And so building trust is key and is important, right? And we have to think through like how we're showing up in spaces really thoughtfully and meaningfully engaging community and sharing a bit of who we are within that community. So I reside in Richmond, Virginia now, but I'm originally from Newark, New Jersey. And I know they introduced me and they said Dr. Lamy. But if I go to certain places in my community, they don't care if I have a doctorate at all, right? It's more so, who are you? Where are you from? And what neighborhood did you grow up in, right? So if I'm here with X and, I'm from West Side, I'm over, oh, okay. All right, that's the validation in the room. People want to know who you are. I am all those things that were mentioned in my bio, but I'm also a mother of 3. My kids are 4, 5, and 6. So when I talk to parents, I use that as a way. Yes, they are 4, 5, and 6. That's another story and another presentation. But that shows up in my work with parents as a way like, hey, I can relate. I understand what it means to be a working mom and trying to do all of this and also the importance of a village within that situation, right? So thinking through like how do we share bits and pieces of our story to connect to the people in the room is also really, really important, right? So having these authentic relationships when you think about collective impact and power building is really important. There's some things I also want to throw out there because in order to build relationships and overcome some of the challenges and the mistrust that has historically been there because it's rooted in systemic racism, because of all of the challenges, and because I talk a lot in the education space. And one of the things I like to say is folks say education and school systems are not working. They actually are working. They're doing what they're designed to do. They were never designed to make sure that all young people had access to quality education. So in order for it to work, we have to transform it, right? It's inevitable. But in order to do that also, we have to think through, like, how do we create and build these relationships in thoughtful, meaningful ways and not say we're going to do something and then for whatever reason the ball is dropped, right? So I had put this diagram up there, and I think some of you probably can relate, especially because the work sometimes gets really dense and heavy. So on what side is it? On the right side of your screen, there are 12 ways to build trust, right? All of that looks good, right? We're going to honor our commitments, right? But then sometimes we run the challenge of overcommitting. We end up saying we try to do so much that we end up doing and accomplishing nothing at all, right? We say we're going to communicate properly, but sometimes there's a lack of clarity because we haven't taken the time to actually think through what it is that we want to do together. Not just what my idea is, but what is our collective idea and strategy. We say we're going to make careful and thoughtful decisions, but then there's a sense of urgency, as if there's a fire that's burning that has to be put out tomorrow. Unfortunately, a lot of the issues and challenges that we're facing now, today, have been around for quite some time, right? They weren't built overnight, and nor will the solution come overnight. Y'all agree? So you have to take time. We need to make sure there's a consistency. And then I put up there, too, only listen to respond, because sometimes when folks are talking in groups and we're coming together and there's an organization that put everything together, and then everyone is talking, they say, and then they have in their mind already the next thing they're going to say out. They didn't take time to process the information in the room. That's a great way to get a whole lot of people at the first meeting and hardly anybody at the second. Right? So we got to think through those things. We need to make sure there's transparency. We need to we need to also make sure that we're not avoiding conflict. Conflict is inevitable within the work. Everyone's not always going to agree. I always tell people never be too consumed by the size of the room and how many people are in the room. A lot of historical movements started with 1 or 2 people coming together and then bringing on additional people and additional people coming to the table, right? Dr. Green talked earlier about innovators. And in this work, it is all about innovation when you talk about systems change, right? But every innovation had to come from somewhere, right? But before it, there wasn't it. Right? There was a time when we didn't have airplanes, we didn't have telephones, and now we have cell phones, right? Anybody remember the phones that used to hang on the phone booths? I see some seniors in the room, right? And now we got cell phones. Someone had to think of that. So what happens when we start with first understanding and believing the innovation is already in the room? Let's stop thinking about what we can't do. Let's stop focusing too much on the problem. Let's start thinking about the energy that's already in the room. The solutions are already in the room, especially when you bring youth to the table. They got a whole bunch of innovative ideas. Especially when you bring our seniors to the table. They've seen some stuff. They know some stuff, right? And so we need to think through how we create these shared spaces and engage community, because a lot of the solutions are deep-rooted inside. But we have to create the space to make sure that they come out. I always like to, how many folks in the room have organizations or running their own organizations? Any organization leaders here? Okay, all right. Any advocates, activists, community leaders? Okay. Who's in the room? How are you showing up today? Just call out. We're just calling out. How are you showing up today? What role are you in? Caregiver? Service provider? I can't hear you over there. Clinicians? Okay. Okay. All right. This slide here is about addressing the elephant that's sometimes in the room as well. When you think about creating spaces, especially when you have the dynamic there where there are a lot of people with different titles, different roles, some are organizations, some are community leaders, et cetera. And then you have to enter into the space, you have to think through power dynamics as well. So we're actually going to do a power mapping activity after this. But I want you all to enter into it thinking through these things too. So one, sharing power is hard. You know, I used to always do, I haven't done one, that is just, that is a reminder that I have to do that with my current team. But I haven't done one yet with my current team. But one of the things I used to do is I used to have these meetings with my team, my staff. And they would be cap-off meetings, hats off, meaning no titles, just ideas, no titles. And we would throw out all the ideas. It was the innovation space, all the ideas. No one like, oh my God, there's no way in the world we can do it. And we didn't talk about what we couldn't do. We just talked about all the possibilities, right? And they had some ideas sometime, and I was just like, I don't know about that. I don't think that we should do that. And they were like, listen, we need to do this, we need to do that. And I would get outvoted in the organization that I was leading. And I would say, you know what? You have the vision for that. I can't fully see it yet. You all voted that that's what we're going to do. So you're going to lead it, and we're going to support your leadership of it, right? That requires sharing power. It's hard sometimes, but that a lot of the changes, a lot of the innovation that I've been able to do has come because of that. Because a parent came up to me in my work with young people and said, listen, I love your program. I know if my kid completes your program, they'll get a full scholarship to college. However, they have to work this summer. And I said, okay, so that's an issue we got to address together. We partnered with the city. We employed young people. We trained our teens to teach our middle school kids about high school. They created their own lesson plans, and they implemented them. An idea that came from a parent. You know what I mean? So imagine what happens. That's just one, but imagine what happens when we take those challenges seriously and we start thinking about how we can use the resources that we have within community and actually create assets, right? By bridging those gaps, right? But we have to share power. We have to think through also sharing resources. We need to make sure that we're not focused solely on our organization's mission, that we forget that it's not just about us individually, it's about us collectively, right? And so sometimes it's like, oh, well, if we do, I always tell folks, if we do this work well, and you're an organization and you're a nonprofit, technically, you should all either put yourself out of business or within 10 years from now have a new mission statement. Does anybody know an organization, a nonprofit, that ever had to redo their mission statement because they fulfilled it? Anybody? They had to redo the mission. Oh, we got to tell that story. What, an organization had to redo their mission statement because they fulfilled it? Or they just changed it because they wanted to change it? Yes. Uh-huh. That's what we should all be aiming for, right? We should be aiming for fulfilling those mission statements, but complex issues require complex solutions, right? Any mission or organization sets forth cannot be completed alone, if it's especially within the nonprofit sector or the community sector. We have to begin thinking through how we all work together. Thank you for sharing that example. Oh, the last one here is that I hear this oftentimes. Historically, we don't work together. And I put that there too because that's also an elephant in the room, because I've seen organizations and folks come together and they're doing pretty much similar things, but for whatever reason, maybe the former CEOs or the former staff didn't get along and they don't work together. And sometimes it's so historical, they don't even know what the root cause of the issue is, right? But it's hindering the work. And so what I used to say also is, like, when I'm working in communities and I'm serving young people, if, everyone's not gonna like you, everyone's not gonna love you. But if you come to me and you need something and it's regarding young people, our passion work, our focus, our drive, our energy, that we should share that common agenda, and we should want and be willing to support one another, right? And we need to be able to break down those barriers as well. So a bulk of the breakout session group is gonna talk about power with, power to, and power within. That's what we're gonna use as part of our work in our power maps, right, that we're gonna develop together, right? But that requires us breaking down the belief and the myth of the have and the have-nots, right? And that is the power over category, right? And power over suggests that power is seen as finite, You have it or you don't, right? People use coercion or force to kind of intimidate people in order to keep their power, right? And that, a lot of times when people say either you have it or you don't, they view people in community as being powerless, right? And if we think that we're powerless, we'll never be able to change anything, right? So I encourage you all to look deep within and think about yourself first and foremost, and also your community. And let's think about our community. What do we have the power to do, right? What is it that we can all come together and we can say we have the ability to change this, right? And if we're going to change it, what's our power within? Within ourselves or within our organizations that we represent or the work that we do to actually do it, right? And then who do we have power with? Who else needs to be at the table in order for this change to happen or occur? Who's missing? Who do we need to engage? Who do we need to partner with? Who needs to fund it? Okay? So the activity that you all will have in your breakout rooms is you'll see a sheet that looks like this. And this sheet will walk you through how to develop a power map, right? And so I'm gonna ask a couple of questions. I hope we are all on one accord. What do you feel should be the center of the power map? We're talking about collective impact, we're talking about power building. Who should be in the center of our power maps based on what we've been talking about so far? Go ahead, it's okay. We're all in this together. The individual. Or the people, yes, the people, the community that is centered in it, yes. And you had something to answer? Okay, all right. And then you start thinking through all of those resources, right? So I want y'all to join me in something. Touch your neighbor briefly and say, neighbor, an asset is a resource, but every resource is not an asset. An asset is a resource, but every resource is not an asset. Then what is a resource? A resource is a potential asset that has been untapped. It hasn't been activated, right? My sneakers can be a resource for me going and jogging around this building a couple of times. But they don't become an asset until I put them on my what? My feet. All right? So when you're doing the power map, think about your resources and your assets. And how do you activate the resources? And how do you better utilize your assets? How do you activate your resources? And how do you utilize your asset? Community, the ground of community is the forefront of it, right? So if we're saying, think about the various spaces in which whoever's in the center, youth are in the center, where are they? Where do they go? Where are the spaces that they occupy? Who are the people that they connect with? What is it that they're saying that they need, right? Same thing for seniors. I know there's a group on youth, a group on seniors. Are we doing the black men group as well? Okay, youth and seniors. So based on those groups, who's in the room already? What are they saying that they need? Who's missing from the room? Who do we need to tap into? What are the resources and what are the assets? Okay? And that can be community, local, state, national, etc. All right? Questions. I see faces that are thinking. Questions. Y'all ready to build power? Are y'all ready to build power? Okay. Anybody have a question? Okay. Can you have access to the slides? I will talk to the Arthur Ashe Institute folks to kind of get a sense of what we could do with that. Okay? All right. So I'm gonna turn it over to them to break you into sessions. You all are gonna go and do the power map. Do not be too consumed with getting it quote unquote right. That's not the point. The point is to build relationships within your group, learn about the people within your group, where are your resources, where are your assets, how you can work together, right? So, and then we'll come back and we'll have a discussion on the power mapping activity. That sounds good? All right. Thank you.
I think Dr. Lamy deserves a warm round of applause for the excellent job that she just did.
Hi, everyone. If you could please make your way to the seats so we can so we can start the debriefing conversation. All right. So we're going to ask the representatives from each of the groups if you can kind of send one rep to the front that'll help share out on the power building activity that you did. We just want a top level report out. Keep it as if it's almost like an elevator pitch, like no more than 2 minutes. How long, everyone? 2 minutes. 2 minutes. Okay. So we would like the senior group to go first because we want to honor our elders. So can someone from the senior group go first?
What's the question?
So if you can just give us a top-level feedback or on what
On
your
our
group,
discussion.
Yes, talk
Okay,
about what
so
your power
I
map.
was in a group with senior citizens. I'm much too young for that, but I was in a group of senior citizens. I like to be around older people. And so we discussed how can we be more effective, how can seniors be more effective in their healthcare advocacy and doing things that they're concerned about. So first we addressed a few issues. And one of the issues was that seniors have trouble advocating for themselves. As a matter of fact, our director was telling us how she was advocating for her mother and some relatives. Another thing that we discovered, another senior brought up an issue that I'd never thought about, and they picked up by Accessoride. And sometimes they might be an Accessoride for two hours, driving all over the city. Now, if that was a profitably run operation and people were paying out of their pocket, they would never take them an hour or two out of the way. But since they're getting the money from the city or the state, they don't give them very good services. So we talked about that. We also talked about, indirectly, white coat syndrome and how some seniors, because of race or age or color or sexuality, don't advocate for themselves. And so we talked about a lot of issues, and then we said, well, what can the seniors do about it? And we know the way that people are getting things done in America now is what? Collective bargaining. You know, doctors do collective bargaining. They belong to IPAs. And doctors get together and negotiate with health plans. Not as one doctor, but as 500 doctors. It's 250 doctors. They belong to a union. So what can seniors do? And so we decided that the seniors should get together with their senior citizen directors and say to them, 5 or 6 of them get together, talk to each other, and then bring in the elected officials in 3 or 4 months. And let's talk to the people, somebody from the city council, somebody from the state assembly, somebody from the state senate, somebody from Congresswoman Yvette Clarke's office, and other representatives, and tell them what our pain is. We should invite them in as well as the Commissioner of the Department of Aging would handle senior citizen issues. So we talked about the problems that we're having as seniors. How do we address these problems? How do we find adequates? And what's the solution? And another thing we were all in agreement that we were absolutely delighted that the Arthur Ashe Foundation had this wonderful conference, and we wanted them to cover another one in maybe 3 months or 4 months when we can get together. So today was just a starting step. There are a lot of strong seniors, especially this beautiful woman right here, my granddaughter, who was one of the leading advocates of what we did. Have I answered your question or not?
Yes, thank
Okay.
you so much. And there was also a professionals group, a clinician group. Do we have a speaker from there to report out? They're showing. Okay, can a speaker from the youth group come forward?
Hi. So I appreciate that because I'm sort of a youth, but not. My name is Keely. I'm reporting out from the youth group. We had a really wonderful conversation mostly about social media usage with youth because we're finding that it's a hotbed of bullying and extremism. So we wanted to think about ways to empower youth, to enhance their discernment, to connect them to themselves, and we came up with a statement: the power to define and boldly claim their self-identity, awareness, concept in a protected manner. So we talked about who we could involve in this project, and this work is already happening, but we want it to be more cohesive, more enhanced, and we talked about stakeholders like teachers. We talked about the role of places like the Arthur Ashe Institute, places like clinics, hospitals, community centers. We talked about the role of older youth and how mentorship could assist in learning how to discern on social media, because not all of us grew up on social media. We talked about bilateral sort of connections with elders, just in order to share expertise mutually. And that relationship is not always looked at that way, but there's a lot of richness there to be explored. And we talked about just places in the community where we could have safe spaces, open conversation, counseling, and connecting youth with trusted, socially responsible, transparent, non-judgmental places where they can, again, define and boldly claim their self-concept in a protected manner. We did briefly talk about suicidality in youth. I would have liked to get into that a little bit more, but we really focused on where we could have some immediate impact and how we can connect. How do we feel about that youth group?
Thank you.
Okay.
Is the last final group down yet? So there are a couple of things. First off, give you all yourselves a round of applause. I've been in Virginia now for about 4.5 years. I was like, oh, I sound so country right now. Give y'all selves. I'm a Jersey girl, but I had to pause on that when that words came out my mouth. But a couple of things also I want you to add in your future discussions, because a power map, I always tell people, it's almost like a strategic plan. It should always be evolving and continue to build on it, right? It's not set in stone. So you should always be asking yourself and be mindful of who's at the table, who else can we invite to the table. I put at the last bullet, make sure there's ongoing conversations about who is missing and who should be added. So for instance, in the youth power map, we talked about who was missing in the room for that youth power map that we were talking about yesterday. The youth. It was a lot of parents there, and they spoke about their experiences working with their children. But we would really love to make sure youth are at the table next time, right? So how can we build that up? You also need to be mindful of when and why people leave the table, right? Sometimes it's because they may not be as actively engaged in the work. And sometimes it's because the work isn't happening or being done in the way in which they envision it, right? Ultimately, understand that everyone will not be equally invested or involved and engaged within the work. And that's okay. You don't necessarily need everybody, but you should be inclusive, right? There are going to be times when you're doing power mapping or when you're doing the work where some people are just going to be more invested in certain parts of it than others. There's a difference between having a collaborating partner that's an ally and just having an ally. They may just show up if you're having an event or if you're hosting something, but they may not be a collaborating partner deeply rooted in doing the work with you. But you should be inclusive and invite everyone to the table and make sure that folks know what's going on. Because just because they're not at the table today and they say they don't want to be involved in the work today doesn't mean that they may not want to be involved in it tomorrow, okay? And that also ties into the open communication. I also wanted you all to think about not necessarily always having to approach the work through the lens of we have to now create another coalition. We have to now create another ecosystem. We have to now create another collective, especially if they already exist, right? You can think about how to connect the dots and connect the tissues with tables that are already there and not necessarily go into trying to create and invent new spaces all the time. Sometimes another table is actually just another meeting, unfortunately, and people don't have the time to do that. So how do you begin to show up and actively engage in the spaces that are already there and think through the common agenda within those spaces as well, all right? Are there any other thoughts or comments that you all wanted to share out based on what you talked through?
Good afternoon, everyone. My name is Brittany. So we're just coming back from the mental health provider breakout session. So I'm just going to give like a brief breakdown of what we discussed. And if I miss anything, folks from the group could chime in. But essentially, we spoke about first question that was asked was like, okay, what is a provider? And in the group, we realized after introducing ourselves, a provider is more than just being in the clinical space and understanding that we're all providers as parents, as caregivers, in the clinical space, in the non-clinical space. Let me just kind of get my thoughts together. And so that was the first thing we kind of highlighted. And then speaking through the needs that, well, the things that are needed within mental health spaces we spoke about clinical evaluation and care, access to resources. I'm trying to name them on top of my head. The next one. Yes, caregiver education, guidance, support, how to ask for support, language. We talked about having a trusted, safe space, being able to check in and follow up and recognizing the awareness of humanity and gaining awareness through others and experiences, right? A lot of people shared their own personal stories, and we talked about how through those experiences, it's allowed them to gain awareness. I don't want to go too much in depth because I don't want to publicly share everyone's stories, but you know, I hope that was kind of making sense a little bit. And then through that, we highlighted the needs and we understood what the needs were, and then speaking about what is the assets and the resources that we currently have for those things. And so we listed those out, and then we spoke about how Downstate is a resource and an asset, how Kings County is an asset and a resource, the barbershops and hair salons we work with here at the Arthur Ashe Institute, and even a lot of spaces within Downstate that are being underutilized, and how can we get people from outside to utilize those spaces, hiring therapists and other mental health providers to come in and also like taking care of patients and patient care within those spaces. And then come to find out that there are a lot of outpatient care services, and we talked about the gaps that the gaps that are currently here. We can have a lot of conversations about what's needed in the community and opening up all these other organizations and running all these spaces, and recognizing that a lot of these things is happening in silos. So how can we come together as a community to be able to share those resources and work together? Out of that conversation, we talked about outpatient care. And so kind of to end the conversation was, okay, we understand there are gaps and then there are resources and underutilized spaces. And so can we list some spaces that we all know about so that we are aware of it? And through that, we learned that there's Suite O in Downstate, we have Suite B, Suite D, Suite R, and these are all outpatient care services. We have other organizations such as Baltic Street, Respite Centers, NYC 988, and Mentally Parenting, and these are all different types of organizations. And if it wasn't for this space, we wouldn't have known about them. If it wasn't for this space, we wouldn't have known about all these other services that are being provided here at Downstate. And so we came to like this solution-based conclusion in that there are things that are already existing, and now that we know, we can share it amongst each other and share it with other people within the community. So yeah, if I missed anything else, other people on the team can include or add. Thank you.
Thank you. So thank you all for your time. And just two pieces I do want to leave you with. When we think about power and our collective impact in the work that we do towards health justice, one, it's really important to make sure that we're always continuing to center the people most impacted within the work. As I stated earlier and throughout the presentation, they should be at the table when key decisions are made. They should be at the table when we're thinking about policy changes and so on and so forth, right? So whether it's youth, whether it's seniors, whether it's Black men, whether it's people with disabilities, et cetera, and the list goes on, we need to make sure that they are actively engaged in those spaces when we're thinking through what's the quote-unquote collective plan, what's our common agenda, right? And then the last and final piece is create transformational systems. In order to create transformational systems, we need to think about how they evolve over time with, for, and by youth, families, in the community, right? So the system needs to change over time. It's continuously changing and evolving. A transformational system is not just quote unquote a new system. We're not gonna go from the current healthcare system just to an entirely new system and it be etched in stone for the next 2 or 3 decades. We need to create a system that centers youth and families in the community, so as key decision makers, they're constantly impacting the various things that are happening with the system. The system is transforming and evolving because of them. So if new issues or challenges come up, hey, COVID, we're not in shock with what our strategy should be because it's constantly in tune with the people. Our outreach is constantly in tune with the people. So I want folks to think about that too, because there's a lot about transformational systems and all of it. It's this new big thing. But if you, I always say, if you take a system and you destroy it, you dismantle it, and you don't invest time and energy into what you're creating, you'll end up with a bigger boogeyman than what you started with. So we have to invest the time and energy into making sure that we're thoughtfully engaging one another and planning our next steps, because the opposition always is. Thank you.
So we want to thank Dr. Lamy. I want to thank everyone that participated in the first half of this program.